And joining me live now from New York is Dr. Bruce Y. Lee. He's a professor of health policy and management at the City University of New York's School of Public Health. Thanks so much for being here with us. Really appreciate it. So we've got nurses striking in New York and tens of thousands more potentially about to walk out in California and Hawaii. Are you surprised this is all happening now?
No, not really, because if you think about it, over the past several decades, there's been growing trends that have been concerning about healthcare professionals in general. So one is growing burnout rates. There was actually a 2022 U.S. Surgeon General report about the problem of burnout among healthcare workers, healthcare personnel, including nurses, that cited many concerning trends. And then also you see a growing separation, a growing gap between the pay of healthcare executives, like hospital executives, and healthcare personnel. And then lots of other trends that are happening in the industry that suggest that the system is broken in general.
On that report on burnout, I mean, that was 2022, if I'm right, that came out.
Mm-hmm.
It's been a couple of years now. I mean, why hasn't anything been done?
Yeah, that's the concern, because the report clearly stated that these were trends that predated the COVID-19 pandemic. I think that the pandemic really uncovered a lot of the existing problems, as we saw. There were problems with a lot of the clinics being understaffed, a lot of the hospitals being understaffed, and healthcare workers really working around the clock. And the report emphasized that a lot of these trends predated the pandemic. Pandemic simply uncovered it, and it's been going on for decades. And what should have happened is this should have been a call to action to really change the healthcare system, make major changes, but we didn't really see them after 2022.
All right, so as we saw in that report, I mean, the nurses in New York say it comes down to three things: staffing levels, pay, and security. So we sort of talked about staffing levels there. On the pay issue, I mean, there's a study from Health Affairs showing that the hospital executive pay went up 27% over the past 15 years, while regular hospital workers saw less than 10%. So how much is that pay gap fueling what we're seeing now?
Yeah, there's been growing concerns, I think, among healthcare professionals about that pay gap, and in the nurses' strike, they pointed to the fact that executives are making quite a lot of money, because these are known trends. And so the concern is, well, okay, if there are people within the healthcare system that are making a lot of money, why isn't that money coming down to people who are on the ground, who are actually taking care of patients? Ultimately, the strength of healthcare system really depends on the people who are taking care of the patients directly, such as nurses and doctors.
There's the issue of security as well. I remember that was such a huge issue during COVID, when nurses were sometimes being, physically confronted by people who didn't want to comply with regulations and so on. I mean, is that still an issue that nurses are dealing with? Is it that big a topic for them?
Yeah, one concern is that it may actually be increasing. You're seeing more and more misinformation, disinformation about science. You're seeing more expectations on healthcare personnel and professionals, and that the question is that raising antagonism versus healthcare professionals? And also on top of that, there's concerns about mental health issues, growing mental health issues in our country ever since the 1980s. And is that fueling some of the potential violence or attitudes toward healthcare professionals? So you see healthcare professionals having to deal with increasingly, challenging workplaces, challenging situations in and around the workplace. There's also talk about, how much harassment is occurring, how much discrimination is occurring within healthcare systems too.
Anyone who's been, unfortunate enough, I guess, to be hospitalized knows how important nurses are. I mean, when nurses walk off the job, what actually happens inside a hospital? What does that look like for patients?
Well, if you think about it, nurses are key to nearly every function within a hospital, clinic, or emergency room. So they many times are the direct point of contact with the patient. So the patient sees nurses throughout their stay. The nurses are taking care of the patient's problems. Many times they listen initially to what's happening with patients, but they also, nurses play key roles throughout all the different types of operations, ranging from filling out paperwork to ordering different types of medications, to interfacing with the doctors, to actually, in some cases, performing a lot of the healthcare operations itself. So it can have a trickle-down effect too, because if nurses are not available, then the rest of the healthcare personnel professionals who are already in many cases overstretched are further overstretched. So then you're having reverberating effects throughout the healthcare system that in turn can adversely affect patient care. Not only might it lead to delays, so you'll be seen later than you'd like, and that can be a huge problem in the emergency room, for instance, or when the situations are urgent, but it also can potentially decrease quality of care, lead to safety concerns, and all of that ultimately can then affect patients adversely. Not only does it affect patients, so whenever patients are affected, then greater society is affected, because disease and medical problems lead to decreased productivity. So it's a significant effect.
Yeah. Sounds as though many long-standing issues haven't been addressed here that definitely needs to be. Bruce Wiley in New York, thanks so much for speaking with us. Really appreciate it.
Thanks for having me.